Hello, everyone. Today, we'll be discussing trauma-related mental health disorders and examining them from the least to the most severe. Trauma impacts individuals differently, and understanding the spectrum of disorders can help us recognize symptoms, seek out the appropriate treatment, and provide the appropriate support to those who are affected. Trauma-related disorders arise as responses to distressing life events. While some individuals recover quickly, others may develop mental health conditions that persist and impact their daily lives. These disorders range from mild and short-term to severe and chronic. In this presentation, we will cover 5 primary trauma-related disorders, including adjustment disorder, acute stress disorder, post-traumatic stress disorder, or PTSD, complex PTSD, and dissociative disorders. As we go through each one, we will discuss their symptomology, causes, and their respective treatment options. We begin with adjustment disorder, which is the mildest trauma-related condition. This occurs when someone struggles to cope with a significant life change or stressor, such as job loss, divorce, or an unwanted relocation. Common symptoms include sadness, anxiety, difficulty concentrating, and challenges in their daily functioning. Unlike more severe trauma disorders, symptoms of adjustment disorder typically resolve within 6 months after the stressor is removed. Treatment focuses on short-term therapy such as cognitive behavioral therapy, CBT, and supportive counseling. In some cases, medications may be prescribed to manage uncontrollable distress. Acute stress disorder, or ASD, is more severe than adjustment disorder and occurs within 1 month of experiencing a traumatic event. It is often considered a precursor to PTSD. Symptoms include intrusive thoughts, flashbacks, disassociation, hyperarousal, and avoidance behaviors. Individuals may feel disconnected from reality or experience emotional numbness. Treatment typically involves trauma-focused CBT, exposure therapy, and stress management techniques. If untreated, about 50% of individuals with ASD may go on to develop PTSD. PTSD is one of the most well-known trauma disorders and occurs when symptoms persist 1 month after a traumatic event. PTSD symptoms fall into 4 categories: intrusive memories such as flashbacks and nightmares, avoidance, avoiding reminders of the trauma, negative mood changes, depression, guilt, and emotional numbness, and hyperarousal, irritability, insomnia, and/or hypervigilance. Treatment for PTSD includes trauma-focused therapies such as eye movement desensitization and reprocessing, or EMDR, cognitive processing therapy, or CPT, and medications like selective serotonin reuptake inhibitors, SSRIs, that manage symptoms. Complex PTSD, or CPTSD, results from prolonged or repeated trauma such as childhood abuse, domestic violence, or captivity. Unlike PTSD, which usually stems from a single traumatic event, complex PTSD is associated with long-term chronic trauma exposure. Symptoms include emotional dysregulation, difficulty maintaining relationships, negative self-perception, and a sense of helplessness. Because CPTSD is more complex, treatment often involves long-term therapy, including trauma-focused interventions, dialectical behavioral therapy, DBT, for emotional regulation, and sometimes medication to manage mood symptoms. Dissociative disorders are among the most severe trauma-related conditions and often develop in response to extreme or repeated trauma, particularly during childhood. Dissociative disorders include dissociative identity disorder, formerly known as multi-personality disorder. This condition involves the presence of two or more distinct identities or personality states. Depersonalization, derealization disorder involves feeling detached from one's body or surroundings as if in a dream or outside the observer of oneself. Treatment for dissociative disorders is long-term and includes psychotherapy focused on integration and trauma resolution. Medications may be prescribed to manage co-occurring conditions such as depression and/or anxiety. In summary, trauma disorders exist on a spectrum, from mild stress reactions to severe dissociative conditions. Early intervention and appropriate treatment can significantly improve outcomes. Mental health professionals use therapy, medication, and support systems to help individuals recover from their trauma. If you or someone you know struggles with trauma-related symptoms, seeking professional help can make a meaningful difference. Thank you.